Is a persistent low-grade fever normal after surgery? Imagine waking up after surgery and feeling a slight warmth or mild fever. You might wonder if this is part of healing or something more serious. Well, it is quite common for patients to experience a low-grade fever after surgery. This fever usually stays between 100 degrees Fahrenheit and 101 degrees Fahrenheit. It often appears within the first 48 hours after the procedure. This mild fever is your body's natural response to the trauma caused by surgery. When your body is healing, your immune system kicks into gear, which can cause a slight increase in temperature. It's a sign your body is working to repair itself. Sometimes, this fever is caused by inflammation, which is part of the healing process. Other times, it can be due to shallow breathing after surgery, leading to a condition called atelectasis, where parts of the lungs collapse slightly. Most of the time, a low-grade fever is not dangerous and can be managed with over-the-counter medications like ibuprofen or acetaminophen. These medicines help reduce the fever and make you more comfortable. It is also helpful to stay well hydrated and get plenty of rest. Following your healthcare provider's instructions on medication and self-care is very important during this time. However, if your fever lasts longer than 4 to 7 days, it might be a sign of something more serious. Persistent fever could indicate an infection. Watch for other signs like increased redness, swelling, pain, or pus at the surgical site. If you notice these symptoms or if your fever starts to rise above 101 degrees Fahrenheit, contact your doctor promptly. Monitoring your temperature regularly is a good idea. Keep track of any changes or new symptoms. While a low-grade fever can be part of normal healing, it's always better to be cautious. Your healthcare provider can determine if your fever is part of the normal recovery or if further investigation is needed. In managing a postoperative fever, follow your doctor's advice closely. This might include taking medications as prescribed, practicing deep breathing exercises, or using an incentive spirometer to keep your lungs clear. Staying hydrated and resting are also key. If your fever worsens or you experience additional symptoms like chills, severe pain, or difficulty breathing, seek medical help right away. Remember, your body is working hard to heal itself. Keeping an eye on your temperature and symptoms helps ensure your recovery stays on track. And always reach out to your healthcare provider if you have any doubts or concerns about your fever or overall health after surgery.